Thank you for joining us. I will start with today's statistics as usual. The total number of positive cases reported yesterday was 999. That is 10.3% of the total number of tests that were carried out and takes the total number of confirmed cases now to 67,011. 378 of the new cases were in Greater Glasgow and Clyde, 207 in Lanarkshire, 128 in Lothian and 107 in Ayrshire and Arran. The remaining cases were spread across 8 other health board areas. I can also confirm that 1,254 people are currently in hospital, which is an increase of 29 from yesterday, and 92 people are in intensive care. That is 1 fewer than yesterday. Finally, I regret to say that a further 28 deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28 days. And that means the total number of deaths under the daily measurement is now 2,877. That obviously reminds us again of the heartbreak that this virus is continuing to cause to families the length and breadth of the country, and again I convey my condolences to everyone who is in that position and who is mourning a loved one. I'm joined today by Shirley-Anne Somerville, the Social Security Secretary, and also by the Chief Medical Officer. Shirley-Anne will talk in a moment about the Scottish Child Payment. Applications for the payment will open soon, and we're encouraging all eligible families to apply. This will be a valuable source of additional support for all eligible families, but that includes many who are struggling right now as a direct result of the pandemic, which is why it is appropriate to draw attention to that. I also want to highlight that later today the Health Secretary is giving a statement in Parliament where she will set out details of our plans for adult social care over the winter, which is obviously extremely important. In my remarks today, though, I want to return briefly to an issue that I covered yesterday, the availability of money from the UK Furlough scheme, since there have been some seemingly significant developments since I stood here last yesterday. In particular, the Prime Minister appears to have agreed yesterday that access to the furlough scheme at the higher level of 80% of wages will be available to Scotland after the 2nd of December if that is required. I welcome that commitment, although I do so with, I suppose, a necessary degree of caution. We haven't yet seen any detail of what that commitment means when translated into hard practice. And in particular, we've not yet had confirmation from the Treasury that continuation of furlough in Scotland beyond the 2nd of December would be at the 80% level. We have always known there would be some form of furlough scheme continuing after December the 2nd. That's never been the point at issue. The point is at what level, and we await confirmation that it will be on the same basis, eligibility, and the 80% level that will apply throughout November. Obviously, there has been some doubt cast over the Prime Minister's comments by another member of the Cabinet in a television interview this morning. But notwithstanding that, we still hope that the Prime Minister's commitment will hold and that furlough payments will be available after the 2nd of December on the same terms as they are being made available in November. But obviously, we can't be certain about that until we've seen the commitment translated into certainty by the Treasury, and we're pressing urgently for that clarity. This issue of furlough payments is important. It's very important, actually, for the reasons I spoke about yesterday. First and foremost, it's important for the sake of people across the country who are worried about their jobs and wages. But it's also important for the Scottish government's, and indeed the Welsh and Northern Irish government's, ability to plan and steer the best course we can through this pandemic. With vitally important decisions having to be made by all governments day after day just now, it's not helpful for any of us to be distracted by a lack of clarity from the Treasury. And it's obviously far from ideal, as I tried to set out yesterday, if vital public health decisions for Scotland, Wales or Northern Ireland have to be in any way distorted by the need to access financial support that only takes account of the situation in England. Instead, what we want to do and what we are determined to do is continue to follow the careful, cautious, public health-driven approach that we have taken so far in Scotland. Not least because it has put us, relatively speaking, with no shred of complacency, in a strong position. We face difficult judgments for the future, and as I say, we have no room for complacency, and I'll return to that point in a moment. But as of now, prevalence of COVID is lower than in other parts of the UK, and that is, we believe, partly down to the plan we have been following, and obviously it is very much down to the sacrifices that people all over the country have been making. So we want to continue to base our decisions on the best evidence that we have, and that's what we intend to do. We will be closely monitoring progress this week ahead of our scheduled review of the allocation of levels next Tuesday. The fact that we acted quickly to control the pandemic in September and October means that we are now, we think, seeing some encouraging signs in the figures for new cases. The last few weeks appear to show the rate of increase in cases slowing down. And that is good and positive. And as I said a moment ago, it is down to the sacrifices all of you have been making. But as we know, day-to-day figures will reflect in part the fluctuating demand for testing and case numbers, and crucially the test positivity rate, you'll see that from the figures I've given today, remain high. So we can't be complacent in any way, shape or form. The situation we face, in common with countries the world over, is a fragile one, and we must proceed with great care and caution. So we will be assessing throughout this week whether we might be starting to see a sustained improvement leading to a fall in the number of new cases, which is what we are hoping for, or, on the other hand, whether case numbers are instead reaching something of a plateau. And that's important, and I want to take a little bit of time today just to explain more fully why that is important, and I'll do that with reference to our experience over the summer and so far. The fact is, we can't really take any comfort in a situation where case numbers are continuing to rise, even if they are rising at a slower rate now than was the case a few weeks ago. And we certainly can't take comfort in a situation where case numbers simply plateau, where they stay steady, but at the current high levels of around 1,000 a day. And let me explain that with reference to our experience over the summer. One reason why we might be, we think, in a slightly better position than, say, England is just now, in addition to those early steps we took in late September to start to impose restrictions, is that we did reduce cases to a very low level over the summer. And what that means is that even when the R number started to rise above 1 again, that increase was from a much lower baseline. Had we come out of the summer with higher prevalence than we did, we would probably be in a much more severe situation right now. So that baseline point matters, and it matters just as much, in fact, possibly more so now as we head deeper into the winter period. A high level of cases, even if they were quite steady or growing only slowly, would not be a stable position. It would mean that if the R number was to rise at all during the winter, which with more people inside is quite likely, it would start to drive increased transmission from a high baseline. And that risks the situation very quickly, potentially running out of control. And that would mean more deaths and a possible overwhelming of our NHS. So the point I need to stress is this, and it's a really important point, and I'm stressing it just to try to develop the understanding we all have of the factors we have to weigh up over the next period. And the point is this one. We need to be confident, not just that the situation we face right now isn't deteriorating. We also need to be confident that at current levels of intervention, the situation is improving significantly enough. If we're not confident of that, it may be that we can't move areas down a level, and it may also be that we have to move some areas up a level. And while we hope this will not be the case, that analysis also means that we cannot rule out having to move some levels, some areas of the country to level 4 for a period. Now, we haven't reached those decisions yet. This is a judgment we'll be considering as we assess the data in the days ahead. Now, I'm always aware that when I talk like this, it can fuel media speculation about what's going to happen, and that's understandable. It's the media's job, after all, to try to work out and report what might lie ahead. So that is in no way a criticism. But the view I've taken throughout this pandemic is that it is better for me to try to be open and at times discursive about the factors driving our decisions, so that you understand not just what we're asking you to do, but why we're asking you to do it. So I will continue to try to keep you informed of our thinking and of the factors that we are taking account of as we head towards this first review point of our new level system, which is due next Tuesday. But and let me conclude on this point, because it's an equally important one. In the meantime, all of us have a vital part to play in trying to ensure that the situation does improve and that we don't need to impose more severe restrictions. I want always everybody to remember that none of us are powerless in the face of this. The best thing all of us can do, and we all can do it, to reduce the likelihood of further restrictions, is to abide by the rules now and try to limit as much as we reasonably can the contact we are having with people in other households. And abide by the spirit of the rules. As I said yesterday, please don't look for the loopholes. Don't try to put your own twist or interpretation on the rules. If this is to continue to work, as we believe it is, although we're not yet sure it's working far enough and fast enough, then it takes all of us abiding by these rules to the letter and in the spirit of them. So let me just finish by recapping right now on what we are asking people to do. If you live in one of the areas at level 3, most parts of the Central Belt and now also Dundee, you should not travel outside your own local authority area unless it is essential. By essential, we mean work that can't be done at home or caring responsibilities. And people in other parts of Scotland, please do not travel into level 3 areas except for the same essential purposes. We are also, and this is important, we're also asking people right now not to travel outside of Scotland, not to travel to other parts of the UK, England, Wales, Northern Ireland, and not to travel overseas, again, unless you have an essential purpose for doing so. Abiding by travel restrictions is essential. Within Scotland, it's essential to avoid us taking the virus from high prevalence areas to low prevalence areas, so that those low prevalence areas don't stay low prevalence areas. And of course, more widely, it's important for all countries as they try to suppress the virus within their own borders to minimise the chances of importing it from other countries. In addition, none of us anywhere in the country right now should be visiting each other's homes, again, except for very specific purposes like childcare, or if you have to look after an older or vulnerable person, or if you're part of an extended household. It's a really, really tough restriction, and I speak from experience when I say it gets tougher with every day that passes not to see close family members. But we know that limiting contact with people outside our own households, inside our own homes, is one of the most effective things we can do to reduce transmission of the virus. When you are meeting people from other households outdoors, which you are permitted to do, or in indoor public places, remember the limits. You should not meet more than 6 people from a maximum of 2 households, again, to limit the chances of the virus spreading from one household to another. Avoid car sharing if you can, work from home if you can, make sure you've got the Protect Scotland app on your phone if you're able to have it. And finally, the 5 key rules that help all of us keep ourselves safe, reduce the risk of us getting the virus, and crucially reduce the risk, if we have the virus, of us passing it on to other people. So remember to wear face coverings, remember to avoid places that have crowds of people, remember to clean your hands regularly and thoroughly and clean hard surfaces that you might be touching or that other people might have touched before you, and remember to keep 2 metres distance from people in other households if you are coming into contact with them. And lastly, self-isolate and get tested immediately if you have any of the symptoms of COVID. These rules do help us protect ourselves. They undoubtedly help us protect our loved ones and those round about us, but they also help wider communities, and they definitely protect our National Health Service, and ultimately they help to save lives. So let me just conclude with a summary, a couple of sentences here. We are right now in a difficult position in Scotland, but it is not without its encouraging signs. We have to satisfy ourselves, though, that those signs are encouraging enough and going firmly enough in the right direction. So there are some difficult judgments that lie ahead of us, and that will continue to be the case week on week as we go through winter. But all of us have a part to play here. The reason we have these encouraging signs right now is because we acted quickly and all of you have abided by what we've asked you to do. If we keep that up, then we can be cautiously optimistic that we can continue to see progress through what undoubtedly will be a tough winter, but one that we have to get through and get through together. Thank you very much for listening. I'm going to ask Shirley-Ann to say a few words now before I and the Chief Medical Officer take questions from the media.
Thank you, First Minister. Tackling inequalities and poverty is one of the Scottish Government's key priorities, and we recognise the economic impact that the COVID-19 pandemic is having on low-income families. That is why we are determined to prioritise the introduction of the Scottish Child Payment. Last June, when the Scottish Government announced the introduction of the Scottish Child Payment as a key element of our Tackling Child Poverty delivery plan, it was rightly described by stakeholders as a game changer. Now it is more important than ever. And I'm therefore delighted to announce today that the Scottish Child Payment for families with children under 6 is opening for applications next Monday, the 9th of November. Given the scale of demand, we are taking applications now. This is so we have all the information to make the payments as soon as possible after the benefit officially starts on Monday, the 15th of February 2021. This is almost 2 years ahead of the original commitment for the full new benefit to be introduced. It is my intention to roll out this payment for all under 16 by the end of 2022. This is subject to the Department of Work and Pensions providing the data on qualifying benefits. A timetable of under 18 months from the announcement to the delivery of a benefit is unprecedented in the UK, and I believe this is a testimony to the priority that this Scottish Government has put on tackling child poverty. Now, significantly more families are now relying on benefits due to the coronavirus pandemic, and many perhaps for the first time. Indeed, recent estimates from the Scottish Fiscal Commission now suggest that 194,000 children could be eligible for the payment this financial year. That's an increase of 34,000 children since the pandemic began. The Scottish Child Payment will be delivered by Social Security Scotland and will pay the equivalent of £10 a week per child over every 4 weeks to eligible families who are in receipt of existing low-income benefits. There are no limits to the number of children per family who can receive this benefit, unlike the approach taken to universal credit and the child tax credits by the UK Government, where payments are of course limited to 2 children. The payment, together with the Best Start grant and Best Start Foods, will provide over £5,200 of financial support for families by the time their first child turns 6. For second and subsequent children, this will provide £4,900. Now, we're expecting a significant demand for this payment, which is why we're opening the applications early from Monday, 9th November. And I would encourage all parents and carers who think they may be eligible to apply then. And I'm asking families to help us by getting their applications in early so that we can process and start making the payments as quickly as possible when the benefit begins in February next year. And I'm very proud that Scotland is the only part of the UK to provide this additional support to children. So I would urge all eligible families to apply by calling 0800 182 2222 or visiting mygov.scot/benefits from next Monday. Thank you.
Thanks, Shirley-Ann. We are now open to question. I will go firstly to Ewan Petrie from STV.
Thank you, First Minister. I just wanted to clarify, really, if you don't get the confirmation that you're looking for from the Treasury, do you reach a point where you have to make a decision on further restrictions to make the most of this window? For example, could changes be introduced before the first review of the levels next week?
I've decided as of now that we're going to stick, if we can, to our scheduled review period. I think that's probably on balance the best thing to do. If we don't get the commitment translating into practice, then clearly that has implications for the length of time then that we would have access to the more generous furlough scheme. But I cannot base I have a duty to take ordered, rational as well thought through decisions for the people of Scotland in a really unpredictable and highly uncertain situation and as I can. And I can't allow myself day to day to be distracted and thrown off course by chopping and changing of positions from the UK government. And you can probably detect a degree of frustration in my voice, and that's because it is frustrating. But I need to focus on trying to take the best decisions. I should insert a caveat here, which is not just about furlough. We never rule out taking quicker decisions than a scheduled review point if the evidence merits it or if the wider circumstances merit it. If you cast your mind back to last Thursday, I said that Lanarkshire, which we decided on balance to keep in level 3 and not move to level 4, we were looking at that very closely on a day-to-day basis. Now, the situation there hasn't got worse since then, so we don't need to move more quickly at this stage, but we are looking at that on a daily basis. So I'm going to try and stay on a sensible, rational path here. It's in nobody's interest for public health decisions to be distorted by the need to effectively try to game a financial system. We should all have access to the same financial support. Scotland, Wales, Northern Ireland shouldn't be at a disadvantage to England, nor should we be at an advantage. There should be a level playing field there, and I hope we get to that position, and we'll have to see where we get to over the next day or so, but I need to stay focused on trying to take sound and rational decisions that continue to steer a path through this virus. Mary Stewart from BBC.
Thank you, First Minister. Good afternoon. You're live on Lunchtime Live on BBC Radio Scotland. We've just broadcast an interview with a man who contacted this programme some time ago to raise his concerns that vulnerable patients like his dad were being placed alongside COVID patients at Glasgow Royal Infirmary on poorly ventilated wards. He said he raised his concerns with a consultant who agreed it was, a quote, a wicked situation that he couldn't do anything about. His dad then did go on to contract COVID and died from it. So he wants to know why we're putting vulnerable patients at risk in this way. And would you actually be comfortable with your elderly relative being placed in a bed alongside a COVID patient?
Vary, can I say firstly, I want to convey my deepest condolences to the gentleman who you have interviewed on your programme. Anybody who has lost a loved one to this virus has gone through and is going through unimaginable grief. And that will be compounded in any case where a family believes, for whatever reason, that their loved one hasn't had the standard of care that they had a right to expect. So my condolences go to the gentleman and the family. I haven't heard the interview, obviously, and I don't know beyond what you have told me the wider circumstances. So it would be not fair to the family and not fair to the wider public listening to this for me to try to comment on an individual case that I don't know the detail of. I'm going to hand over to the Chief Medical Officer who'll say a bit more about how patients are managed in hospitals, but we have asked hospitals since the start of the pandemic to operate what we've called red and green zones, which is about the separation of COVID and non-COVID patients. So obviously I would want to look into why in that circumstance that hasn't happened. I thankfully haven't had close family members in hospital as patients over the course of this pandemic. But I do have family members who work in hospitals and have been, actively involved in the separation of COVID and non-COVID patients. So that is important. But I think I'd be very happy to see the detail of the individual case in order that I can make sure that we are looking into that more fully. As you know, towards the end of last week, there was a fire at Heermeyers Hospital, and as I was getting the early reports of that fire and how it had been managed, one of the immediate things that was of a concern was whether, as the patients had been evacuated, there had been any mingling of COVID and non-COVID patients. Now, I'm only mentioning that because it underlines the importance we do place on making sure that the right precautions are taken. So I'm going to hand over to Gregor, and then we'll be happy to look into the particular circumstances more once we have more details of them.
Shall I first Minister has already outlined. The first thing I would like to do is convey my condolences in the circumstances. I'm afraid I don't know the detail of this particular case, and therefore I shouldn't comment any further on it. But across the country, our hospital system has put in really intensive infection prevention and control procedures that include ensuring that we stream patients with suspected COVID or with COVID and separating those from other patients where there is thought to be less risk of that. We call those the green and the red pathways within hospitals, and they're very clearly demarcated throughout the hospital system to try to make sure that we don't have that type of mixing that you have just described in the way that you have outlined the circumstances here. So as I say, I think we need to understand more about these particular circumstances. The infection prevention and control measures across the hospital system are much more intense than even earlier on in this year. As we've learned more about the virus, we've learned more about how we can respond to some of the particular nuances of how this virus spreads from person to person. And the updated infection prevention and control guidance that was produced at a UK level has really strengthened this approach across the country in terms of how we do this. Allied to that, we now have testing regimes, particularly looking at the admissions for the more vulnerable patients who are entering hospital, to make sure that those local teams have the ability to be able to not only test those people on admission, but actually serially once they're in there as well, just to make sure that they're identifying any risks as they're emerging as well.
Thanks. But we will be willing to look into the individual case in more detail if you can provide us with the details of that, if you have the consent of the gentleman concerned. Peter McMahon from ITV Border.
Thank you, First Minister. First Minister, it's quite remarkable in some ways that both you and Douglas Ross, the leader of the Scottish Conservatives, both say that if you have to impose further lockdown measures in Scotland, the Treasury should properly fund furlough. But if that doesn't happen, and if your advisors come to you and say, and I know you don't want this to happen, but if they come to you and say the cases of COVID are on the rise again, there's a possibility of huge pressure on the NHS and it might even be overwhelmed. Even if you don't get the money, you're going to have to act, are you not? Even if you're in the right.
I'll always act to protect health and to protect life. I think that's what I have tried to do throughout, and I've had to take, as all leaders have had to take, very difficult decisions, often announcing things that people don't want to hear. So I will always have that as my top priority, and I will have to set out the limits, as I have done before when we announced some changes a couple of weeks ago when we set out a business support package. I was very clear then that we were doing that even though we didn't have the certainty from the Treasury about the funding flows to pay for that. But I will not compromise on taking the decisions that I think are required to support health and life. That's possibly the most serious responsibility at any time that rests on the shoulders of any leader, but obviously particularly in a situation like this. I think there is, as close as it's possible to get on any issue, universal support for the Scottish Government's position on furlough in Scotland, and I think that's because it is just an issue of fairness, and it's not just about Scotland. It's, when Manchester was going into high-level restrictions a few weeks ago, they were having to fight for every penny of support. Wales, when they went into their fire break, asked for the kind of furlough support that is now being made available and were told no. Northern Ireland have had restrictions not dissimilar to Scotland's in recent weeks and haven't had extra support. I don't grudge people in England a single penny of this support, but it can't be fair that it is only when, not even England as a whole, but the south of England needs that support that it is made available by the Treasury. It's just not fair, and that's why I think there is so much support behind the position that we've been articulating. Of course, the difference between the Scottish Government's position and the position that the Prime Minister and Douglas Ross have been articulating is that theirs is still in very general terms. Ours is detailed, and it's the detail we need to get clarity on. And with the greatest of respect to Douglas, who has made his views clear on this, and fair play to him for that, it's the Treasury that writes the cheques, and therefore it's the Treasury that we need to hear the clarity and the commitment from. When I look at what the Prime Minister said yesterday, when I look at Douglas Ross's comments, I want to see in them the detail that I'm looking for, but it's not yet there. The commitment that after the 2nd of December, Scotland will get access to a furlough scheme. That's never been in doubt because there's always been a plan to have a replacement scheme. The problem is that replacement scheme is on less generous terms. So the detail we need is that beyond the 2nd of December, will our access to a furlough scheme be on the same basis as it is during November, during the period of England's lockdown? And that means the same eligibility and, crucially, the 80% wage payment. And this matters for government planning, as I said earlier on, but it matters more than that. This is a difference for a worker in Scotland between getting your wages paid at 80% and getting your wages paid at 60-odd%. That really matters. And so it's an issue of fairness, and we need to see the clarity. As I said this morning, woolly words don't pay anybody's wages. We must have the clarity from the Treasury, crucially with that 80% commitment. And I hope we get that this afternoon. But until we get it, we can't bank it. We can't bank on having it. So it really, really matters. And this is not a time from any of us, me included, for kind of clever words and trying to hide our intent behind vague phrases. This is a time to be clear with people about what is actually being offered, and I hope we get that from the Treasury this afternoon. Joseph Gartley from Bauer.
Hello, First Minister. Can you help clear up some confusion around the rules on pubs in Dumfries and Galloway, please? Westall News is hearing from landlords who've been told that they have had to stay closed because they don't have the facilities to serve meals. But the level 2 restrictions say you can serve alcohol outside without food. And we understand this is not how the rules are being implemented in other parts of Scotland in level 2, where pubs can serve outdoors, whether they've got a kitchen or not. So should they be open or closed?
I'm not going to comment on individual cases before I've had the chance to look into them, because there may be a range of circumstances that I'm not aware of that have a factor here. Generally, what you've outlined is correct, that places can operate normally outdoors, but there are restrictions in terms of the need to have a main meal served with alcohol indoors. So that is the position overall. I'm happy to take away the particular point about how that is being applied in Dumfries and Galloway and come back to you later on that point. Shona Duthie from Original 106.
Thank you, First Minister. Here in the North East, we're in level 2, and the likes of Aberdeenshire currently has one of the lowest infection rates in Scotland. If the furlough scheme is time limited and as a result tougher restrictions mean a level 2, 3 or 4, how would you take the public with you? What would the message be to people who may already feel they're in a level above where they should be?
The decisions we're making are not as crude as that. We're not about to put any part of the country into a much higher level than they should be in just because of an issue with furlough. Of course, if there are, I tried to articulate this yesterday, where the furlough thing, if it is really time limited, matters, is if I'm looking at a situation and thinking, do you know what, 2 or 3 weeks from now, we think things are going in the direction of harder restrictions in an area, then the judgment is, well, if we can accelerate that decision and get better financial support for people, is it better to do that than wait? So these are the kind of judgments that might have an influence on, but we're going to continue to take decisions on a firm, rational basis that are right for the suppression of the virus. The suppression of the virus really is what matters here, because all of the economic recovery depends on the virus being suppressed. And you know, we've got the best chance of any restrictions at whatever level being in place for the shortest possible time if we get the virus levels down. That said, take furlough out of this equation, and I was trying to make this point last week, and I will no doubt make it again next week as we all get more used to this level system. It is not as simple as looking at a series of indicators and then reaching an automatic conclusion about levels. So we look at indicators, numbers of cases per 100,000, the projected number of cases per 100,000, test positivity, hospital and ICU capacity projections. But we apply judgment to all of that. So, an area may have very low prevalence right now, but it might be rising from a low base. And even though it's a low base, that rise may be enough to say it's too risky to take it down a level. Equally, and this did influence some of our decisions last week, the interdependencies between areas matter too. We want people to abide by the travel restrictions, obviously, but In some areas, take Lothian and East Lothian, for example, or Aberdeen and Aberdeenshire, people travel to work, essential work from these areas. So we have to take that into account of having two areas where the interdependencies are very strong at different levels, because that could lead you to some unintended consequences. I wish this was an application of an automatic formula that you just put the numbers in and it churns out the level. But we have to apply judgment and sense to this, and we have to err on the side of caution as well. Don't please, nobody watching, underestimate the point I was trying to set out as clearly as possible later on. We are dealing with an infectious virus that if it starts to grow, and it starts to grow from a highish level, that concept of exponential growth very quickly can overpower you. So we need to be really cautious in the decisions we're making, and that's what we are seeking to do. Gregor, do you want to say any more about just the need to be very cautious in our judgments?
So across the country, what we're seeing just as you've outlined is a number of different areas with different levels of disease activity in those areas, and we track those on a daily basis looking for any changes. And even in those areas with low prevalence, we keep a close eye on those just now, because just as they may still be going down the way in terms of reducing numbers of disease prevalence, there's always the risk that we start to see a climb in those areas as well. We want to get onto that as quickly as possible. So whether a local authority has moved into level 1, 2 or 3, we have the same degree of scrutiny in all of those areas. The reason for that is because we know from the way that this virus behaves that very, very quickly, if the R number, if the growth rate begins to rise again, it can change very, very quickly. And that transmission, particularly within communities, can change things in just a matter of a few days as people spread the infection between each other. So that level of scrutiny, the more contact we have with people as we start to reduce some of the measures, there is always the risk, if we're not careful, that the virus gets extra opportunities to spread between us and increase those numbers again. So it's a constant battle, if you forgive the term, between trying to allow a level of interaction that we all find acceptable with each other, with trying to limit the opportunities for that virus to actually spread between people.
Thanks. Neil Pooran from PA.
Thanks, First Minister. You might have seen today that the UK government is planning to introduce what's been called whole city testing in Liverpool, where anyone who wants can have a COVID test regardless of whether or not they have symptoms. Would you consider a similar pilot scheme here in Scotland, or would you just await the results of what happens in Liverpool? And is there enough capacity for testing in Scotland to do a project like this if you want to?
I'll hand over to Gregor, who'll say a bit more about this. We're looking carefully at the pilot in Liverpool. We are involved in UK-wide discussions about new technologies around testing and the move from where we are just now with a PCR-based testing approach into one that has, hopefully in the future, much more rapid testing technologies used at a mass population level. There are a number of issues in that logistically, obviously, but also some of the testing, and Gregor will be able to say much more than I can about this, what's called, I think, lateral flow testing, the rapid testing. I think there is still a lack of scientific and clinical certainty about how often you have to do that test and what the level of assuredness in the results of the test are. So all of this stuff is positive. We want to be in there, involved in it. We certainly don't rule out pilot schemes in the future, but we will want to understand some of the learning from Liverpool as well. And we are, as I say, part of UK-wide discussions on this. I always think it's important to strike a balance when we're talking about this kind of new and potentially transformational approach to testing, that we're really enthusiastic and positive and absolutely pushing the boundaries of that, but not giving people false assurance about how far that can take us before we really understand just exactly logistically and clinically what the impact would be. So that's not always an easy balance to strike, but I think it's quite important.
I think we've spoken before from the podium about the two major technological advances that will start to offer a much clearer exit strategy from how we deal with COVID-19. The first of those we've discussed quite a lot. It's the presence of an effective vaccine. But the second of those is mass testing, which is accessible and acceptable at a scale where you can rapidly deploy that within the population and learn and search for those cases that we currently aren't reaching. Generally, we're not reaching them because people don't realise they're infected. They are either asymptomatic in terms of the infection that they're carrying, or their symptoms are so mild that they don't tend to notice them and cast them off. So mass testing at this is something which is really an interesting development. And we signalled in a recent testing strategy that this was a pilot as it started to emerge across the UK that we would want to take notice of, to learn from that. I think I've said on a number of occasions that the 4 UK CMOs remain in regular dialogue. We speak to each other 3 times a week, at least generally, and we share these developments and the learning from these developments. In fact, I'm meeting with them later on today, and we'll talk about a variety of things there, no doubt including this. But the mass testing approach like this, we're using technology that is acceptable and that is reliable, certainly is something which I think is quite an exciting development. At this stage, the evidence is lacking for how we use the particular devices and approach that they're deploying in Liverpool. But I guess that's the whole reason why this has been piloted, so that we can develop further learning as we go with this to see exactly how that could then be used in other areas of the country. The biggest drawback of the lateral flow testing devices is that their sensitivity is much lower than the PCR test that we've all become familiar with. And therefore, because it's much less sensitive in its approach, there is a strong body of opinion that thinks that we should be doing those tests much more often in order that you're more likely to pick up particularly those asymptomatic cases where there's a low diagnostic expectation anyway.
The other balance, very briefly, the other balance we have to strike is, being enthusiastic about these new potential developments, but also making sure we're keeping our eye on the ball of ensuring that we are making the fullest and most effective use of our current testing system, which is making sure that's logistically working well, that the turnaround times are as short as we need them to be, and that we are encouraging people to come forward for testing when they have symptoms, and also following the testing strategy objectives of expanding use of PCR testing into more asymptomatic groups. So it's not an either or. We've got to do all of these things and take full use of the developments of technology as fully and as soon as we can. Dan Vevers from Scottish Sun.
Hi, First Minister. You said yesterday discussing furlough that, in theory, having greater financial support does potentially, not necessarily, tip the balance of what you call borderline decisions. And you cited the example of Lanarkshire, but of course you've got other council areas that were very firmly in levels 3 or 2 or 1. Edinburgh and East Lothian were sort of tipping towards 2. So given what you've said, presumably you can reassure Scots that you're not planning on pushing the whole of the country or even the whole of the Central Belt into level 4 due to this clarity issue around furlough. And just secondly, if I may, the 7-day average of new cases seems to have peaked 9 days ago at around about 1,450. And it's fallen gradually to about 1,100 today. So under that measure, we're not plateauing, we're improving, aren't we?
If you only look at it on that, but I'll tell you in a minute why it's not sensible to just look at it on that basis. In terms of the first part of your question, is that I said in answer to a question, I don't want people to think that any decision is as crude as only furlough availability being taken account of. That's why I've tried to set out today what we are grappling with, the factors we're taking into account, and the decision-making process we'll go through. And I'm not ruling anything out, because it would be, in the situation we face right now, it would be not a sensible thing to do. But I intend to continue to give people a developing sense of how these decisions are taken and how our thought processes are developing. So if you look at our case numbers, our reported positive case numbers, then over the last 4 weeks, you see a slowing down, first of all, of the rate of increase. And I gave some of these figures in Parliament a couple of weeks ago. And then in the most recent week, that seems to tip into a bit of a fall in the growth of cases. So that is correct. What I am interrogating with my advisors is just the wider context of that. Our, as has been pointed out in questions on probably thousands of occasions now over the course of the pandemic at these briefings, the number of tests we have that we report on a daily basis is a proportion of the total number of tests being done. So the tests we do day on day fluctuates, partly because the symptomatic testing is demand driven. So the 1,000 cases today, it is also important to look at what proportion that is of the number of tests that were done. And actually, I can't remember exactly what it was yesterday, but the test positivity rate I have reported today is actually slightly higher than the one I reported yesterday. So it's important to see these figures in context. I'm not trying to paint a bleak picture of these figures. I desperately am looking for the positive signs in these figures and want to see them. But it's important I don't give people false assurance. It's really important, for the reasons I've set out, that we see the case numbers start to decline to a much lower baseline so that we can go into winter with not absolute confidence, because I don't think that is a feature in a global pandemic, but with a greater degree of confidence that an R number starting to edge up again is not immediately going to tip us into very dangerous exponential growth. So these are complex judgments, and you can't, unfortunately, most days I look at a figure in isolation and wish it was the only one that I had to look at, because it would tell me a much more positive story, but you have to look at these things in the round. Brad?
I think the way that I would view this just now is I think I could express cautious optimism at some of the figures that we've seen over recent days, but it is very cautious, and I'm encouraged by the fact that we're seeing the daily case numbers dropping, but were those daily case numbers to kind of stabilise around about the levels that we're seeing just now at or around 1,000 positive cases per day, that would be, for me, an unacceptably high number of cases for us to plateau along, because what you could infer from that is that we've certainly still got significant levels of disease activity within our communities, and that's likely to lead to a much higher degree of not only hospital admissions, but unfortunately ICU admissions and subsequently deaths as well. Now, over time, if that was to stabilise at that figure, there's always the risk that as we get closer and closer to the kind of deep winter months, when people tend to kind of hide away indoors, and perhaps the kind of their ability to be able to interact in outdoor environments becomes less and less. What we are more likely to see is a rise in the R number again, whereby the kind of greater level of R on that size of a disease pool within Scotland accelerates the pandemic very, very quickly, and that services very quickly become overwhelmed at the same time as they're dealing with other winter pressures as well. So we've got to be very, very cautious in terms of our approach there. So cautious signs of optimism. We need to look at the 7-day average, I think, more importantly than the daily case rate, and we need to make sure that we're factoring in that test positivity as well when we consider those figures.
Two final points from you. One to kind of illustrate the point I made earlier on, and one that is another hopeful sign in our figures just now. To illustrate the point, and forgive me, Dan, if I'm not getting my days or precise figures right here, but over the weekend, I think Saturday, we reported about 1,400 new cases. The total tests that day were 25,000, so we had a test positivity of something like 6%. Today, we've got fewer cases, 999, but the number of tests is lower than it was on Saturday as well. Now, our test numbers fluctuate day to day for two main reasons. Our care home testing, more of that is done on some days of the week than on others, because that's routine weekly testing, and also a large part of our testing is demand driven because it's symptomatic people. So you have to look at the test positivity as well as the overall number of cases. The second point, which I don't want to underline too much, but it's another hopeful straw in the wind. Gregor and I were just talking before we came in here today about hospital and ICU admissions, which in the most recent week appear to have risen more slowly than in the week before that. So these are all positive, optimistic straws in the wind. But I come back to this point that it's not enough for us just to be, steady in the ship. We've got to see these numbers go into decline. Otherwise, we risk going into the winter with too high a baseline and that is not a stable position for us to be in. Derek Keeley from the Courier.
Thank you, First Minister. The Scottish Parliament's Information Centre has confirmed that really huge swathes of the Highlands and Islands still don't have access to home testing kits because of issues related to the postal system. Assessment centres are not always suitable for those without transport, and NHS Highlands says it can't always make individual arrangements. So can you say what work is being done to resolve that issue and make sure everyone in those regions has access to suitable testing?
The home testing delivery system is operated by the UK government, and we work constructively with the UK government to try to resolve all of these issues, and that is ongoing. In addition to that, we are trying to make the availability of testing sites more local and accessible, so the location of the walk-in testing centres, which are also done in partnership with the UK government, we chose initially sites for those that were appropriate for student populations, but we have also taken account of rurality and local populations as well. So this is ongoing work where we're always trying to make testing not just more widely available, but more accessible as well. And we continue to work closely with the UK government in trying to continue that progress. Gina Davidson from the Scotsman.
Hi, thanks, First Minister. Can I ask, at the weekend, more than 300 fixed penalty notices were issued by Police Scotland, and I wondered if you were considering at all raising the notices to something nearer the charge in England, which starts at around £200, I believe. And can I also ask if you have any concerns with the COVID app? Because we've had reports of people being told to isolate through the app after being in contact with a positive case, when in fact they're already isolating because of a previous report through the app. And I just wondered if there had been any concerns about false alerts going out at all. And also, just to try your patience slightly, can I ask your Cabinet Secretary to clarify just what she said on the child payment? I maybe misheard, but I thought she said that it was coming in 2 years early now, when I believe there's been an expectation that the first payments might have gone out by Christmas this year, though that was delayed because of COVID. Thank you.
Shirley-Anne can will answer that question. There has been a delay because of COVID. Christmas has become February, but that is a much shorter delay than COVID, the period of COVID. But Shirley-Anne can expand on that. On the point about the app, I'm not aware of any significant issue with false alerts there, but I'm happy to look into that. If you want to give us more detail of exactly what you've heard, I'll have the technical team that supports the app look into that in more detail. On the question about fixed penalty notices, we keep that under review all of the time. We have a pre-existing, by pre-existing I mean before COVID, framework of fixed penalty notices in Scotland, and we've tried to fit the COVID enforcement regime within that, but we keep that under review regularly. We also try to strike an appropriate balance, and we take behavioural science advice on this between enforcement and encouragement, and the police do that in everything they do. They don't start with enforcement. They try to educate and encourage people and use enforcement as a last resort. And certainly our behavioural science advice says that we get further if we try to persuade people to do the right things for the right reason than just taking an overly enforcement an approach overly based on enforcement, but we keep that under review. I don't think there is an exact, magic formula on this. We just have to learn from experience. The police have done this, and I won't say any more because some of these cases may be live. Can rather than issue a fixed penalty notice, if they think the circumstances merit it, actually take a prosecution of somebody if they consider the nature of the breach is serious enough or flagrant enough that they can do that. So fixed penalty notices are not the only option that the police have. Shirley-Anne, do you want to say a bit more about the timescale for the child payment?
Certainly. So when we initially started to talk about the Scottish Child Payment, we were looking at a delivery date around 2022. We were, however, very keen to make sure that we could deliver this as quickly as possible, because we knew the importance of tackling child poverty, and that was before the impact of COVID came along. So that's why it is 2 years earlier than our initial timetable, because of the way we've designed the scheme, because of the way that we've managed to implement that smoothly, using the technology we already have within the agency for Best Start Foods and the Best Start grant as the basis for that. We have moved from initial payments that we had hoped to make in December of this year to February, which was a loss of 2 months. But I think when you consider the fact that we have moved the agency and the Social Security Directorate to working from home, the fact that we're delivering a benefit within that 18 months from announcement to actual implementation is, as I said in my opening remarks, unprecedented. And we've done that while an entire new social security system has been working under the most challenging of circumstances. And the reason that's happened is because we recognise the importance of delivering it as quickly as possible.
David Ball from the Herald.
Thank you, First Minister. Delayed discharges appear to be creeping up again. The average number of bed days lost to delayed discharge increased by around 5% between August and September. I'm just wondering how concerned you are about this trend impacting on hospital capacity as we head into the winter. And obviously you managed to reduce delayed discharges at the outset of the pandemic. But given the sort of alarm caused around patients being moved to care homes, some who weren't tested, will a different strategy be used this time? Or are you now confident the procedures, particularly around testing, are in place that care home residents will be adequately protected?
Well, we do have different policy in place around testing than we had at the start of the pandemic. I won't repeat all of that because I've gone through it many times, and we adapted that as knowledge and understanding of the use of testing in asymptomatic people in particular developed. So there already is a different approach in place there. We will continue, and Gregor will want to say a word about this as well. I assume that to ensure that the discharge decisions, whether they're delayed discharges or routine discharges, are taken in line with the best clinical advice and in discussion with families about the best outcome for individuals concerned. Put COVID to one side, if it's possible to do that at the moment. I'm always concerned when I see delayed discharges go up because. And COVID should not allow us to lose sight of this. It is never a good thing for a person, an older person who doesn't have a medical need to be in hospital because an alternative can't be found. That's not good for their physical or their mental health or their ability to later live independently. So we always need to work to get delayed discharges down, and that is true during COVID, and it's true at other times as well. But it's important that's done safely in a very person-centred way.
So if I can speak about this from a clinician's perspective, really the last thing that you want is people who are medically fit for discharge, to be in a hospital environment just now because of all the deconditioning in particular that can occur when they are there. And the sooner you can facilitate a safe and early discharge to an appropriate environment from a clinical perspective, that's a very desirable thing to do. So this is something that we monitor very closely, and we work with our health boards and our health and social care partnerships to continually review the level of delays that there are in the system and how we can perhaps facilitate appropriate discharge to the correct environment in as safe a time as possible. The way that we do that now has put in additional safeguards so that we ensure that the testing procedures which were introduced earlier in the year are all in place. But really the key here is that when a person is deemed clinically fit for discharge, there is a whole risk assessment which is undertaken around about them that looks not only at their clinical needs but looks at their social needs as well, to ensure that it's appropriate for them at that point in time to move on to the next environment where they'll be staying.
Simon Johnson from The Telegraph.
Good afternoon, First Minister. I just had a couple of follow-up questions to what you said in your opening remarks about levels in different places. You mentioned that you might put some areas into level 4, but what you didn't say was all areas. So can we rule out a national lockdown being imposed next week at level 4? Secondly, you said that it might be necessary that for some areas to not be moved down a level and stay in the level that they're at. I think when you set the initial levels last week, from memory, you name-checked Inverclyde, Edinburgh and East Lothian as places in level 3 that you hoped could be moved to level 2 at an early stage. And I was just wondering, are you effectively putting people in these sort of areas on notice that might not happen now?
I'm not putting anybody on notice of anything in particular. I'm trying to outline the decision-making process and the factors we take account of. Look, only a fool rules things out in the middle of a global pandemic of an infectious virus, and I try not to, I'm not saying I always succeed, but I try not to be that. It would be stupid for any leader to stand here and say, I categorically rule out anything. There's all sorts of things you hope don't happen and that you hope you don't have to do. But I'm not going to treat people like idiots and stand here and pretend that I can foresee the future absolutely and start to categorically rule things in and out. It's not the approach I've taken. There's plenty of points over the past 7 months where it would have been easier in the moment for me to do that. I would then have had to explain why I was proved wrong later on. But it's not the approach I've taken, because I prefer to treat people like grown-ups and try to share the complexities and the inherent uncertainties of the situation that we're dealing with. And, you know, when I made this statement last week, I gave an indication based on the data then, what areas we thought were most likely to go down. Talked about Lanarkshire, which was the one closest to going up. We have to look at the data as it develops, and that is at the raw indicators, the direction of travel, and the wider judgments around what's happening in neighbouring areas, what's the patterns of travel. I said earlier on, I really wish this was a simple formula where, you know, I know we had controversies around algorithms in another context earlier in the pandemic. This is a context in which I wish it was as simple as just feeding some data into a computer and the computer churning out the answers for us. But it's not, and it shouldn't be, because we are trying to outfox a virus that doesn't, you know, respect any of our human the things we care about as humans. It just looks at ways of transmitting, and we've got to try and be smart enough to try and outwit it. And on the evidence, we've got reason to believe we're doing that, but we can't be complacent and we can't rest on our laurels. So I'll continue to keep all options on the table, because I think when you're in a battle against a virus like this, it's a good idea to have as many tools in your toolbox and not cast any aside just to make life easier during a media briefing. Michael Blackley from the Daily Mail.
Thank you. Good afternoon, First Minister. Just to follow up on that issue, I mean, a lot of what you've talked about today has been the precautionary approach. You've talked a lot about your concerns about high case numbers going into winter. I mean, should people be aware that there might be a decision next week for across the whole of Scotland to have tougher restrictions, whether that's a national lockdown or simply moving up every area one level? And also, just on a related issue, yesterday at Cobra there was the agreement for a joint approach towards Christmas. I mean, is it possible to actually start talking about that at this stage, or is that entirely guided by whether these high case numbers come down? Could I also, just also ask the acting chief medical officer just whether he would advise tougher action to bring cases down ahead of winter?
Himself, but he advises me firmly and without fear or favour on a daily basis. So I'm sure if he is doing that, I will certainly know about it. On your other points, I'm not going to go any further. I've tried to set out the kind of decisions and the factors in those decisions that we have to make, and I'm doing that so that people are aware of that, and it doesn't mean I definitely think we'll get to X, Y or Z outcome by next Tuesday, but it means I can't rule anything out, and nor should I. We are in, and this is what makes all of our lives so difficult right now, we're in a really volatile situation where predicting, you know, even days in advance is is riddled with uncertainty. So we have to be mindful of that, and that means I can set out the ways in which we try to arrive at these decisions, the factors we take account of, the judgments we're making, but I'm not going to stand here this Tuesday and tell you with certainty what decisions we're going to arrive at next Tuesday, because that would not be sensible. Similarly, I wish, in everything right now, I wish I could there's lots of things I wish I could stand here and say I'll never have to announce another person losing their life from this virus, that I know for certainty at some point in the next few weeks we'll all be able to stop living with restrictions, and I wish I could stand here and say and it'll all be fine on Christmas Day. I can't do that, and I would be, if you heard me doing that, you should be really worried about why I was doing that and whether I was being responsible. I desperately want people to have more normality than we have just now by Christmas, but I can't look ahead and tell you exactly what that will be. I think with the other UK governments, we can start to talk about the principles of what we're trying to get to. We can certainly agree that if it's possible, and this depends on spread of the virus in different parts of the UK, if it's possible, we would have a consistent picture across the UK, but none of us, if we are being honest with the public, can actually stand here right now and tell you what that's going to be. If there's one issue in which it would make my life a lot easier just to say, yeah, you'll be fine to meet whoever you want on Christmas Day, this would be it. But it would not be being straight with people. So the most important thing I can say to people is, if we want as much normality by the time we get to Christmas as possible, we must do everything necessary now to drive cases down. Now, for government, that means constantly looking at whether we have to step on the brakes harder to drive cases down further, and that's the kind of decision-making process that I've set out to you. And for all of us as individuals, it means sticking to all of these rules rigidly and strictly, and not thinking, that we can just nip into somebody else's house on a Saturday night and it won't matter. Because if it does matter and you happen to pass the virus or get the virus, you could start an outbreak that makes, frankly, normality at Christmas less likely. So it's down to all of us to try to get ourselves into a position of as much normality by Christmas as possible. Will it be 100% normality? I don't think so, and there's no point me saying otherwise. And is it certain what degree of normality we will have at this stage? Not yet. And I'm not going to stand here and just tell people what they want to hear. I want to hear it as much as you do. I want to see my family at Christmas just as much as everybody else does. But I don't do anybody any favours by sugarcoating the really difficult situation that the world is living in just now. We've got to navigate our way through it, and that's what my responsibility is, to try to do that as best as we can. Helen Puttett from The Times. Oh, sorry, Gregor, you were going to give me some on-camera advice.
As I always try to do. Michael, thanks for your question. I think the First Minister used a term there which I think is a really good question in relation to this. She called the situation volatile, and I would agree with her. Volatile because we are in a precarious point in the pandemic just now. Things can change very quickly, and I think with that in mind, although I have described that I am cautiously optimistic about the change in the case rate that we are seeing just now, that can change very quickly. And we're seeing variation across the country as well. That's important to factor in to our considerations as well. Some of our level 2 areas are showing a decrease in numbers. Some of our level 2 areas are showing an increase in numbers. And that's the same in our level 3 areas as well. So we chart that, and it's important that we see what the trajectory of each of these areas is due, rather than relying on any single measurement on any single day to guide us in the advice that we give. Now, those trajectories, as I say, give us some cautious optimism just now. But as I said to one of your colleagues earlier on in the briefing, what I would like to see is our case numbers falling further than we currently see them just now. if those case numbers were to stabilise around about 1,000 cases per day, for me, that would be far too many to be taking into this winter period. And in those circumstances, my advice to the First Minister and other ministers would be that it would be time to take action to try to reduce that down further. We can all play our part in this. And the other thing I want to get across is I want to thank everybody out there for the measures that they're taking to try to restrict the transmission as well, because it's the things that you're doing just now that are actually helping these case numbers to fall just now. And we can all play our part in that by sticking to our guns and making sure that we're complying with the measures, that we're following the facts guidance, and that we're reducing the opportunity for this virus to transmit from one person to the other. And if we do that, we stand ourselves in a much better position of being able to avoid further measures at some point in the future.
Thanks. Helen Patrick from The Times.
Thank you. Thanks also for your commitment to openness about the discussions and decision makings around the pandemic. Given that, can you now publish the full minutes and the records of the Scottish Government COVID-19 Advisory Group? And also, could you tell us, are NHS staff, including doctors, public health consultants and managers, allowed to share concerns they have with the media and with the public without facing any reprimand or repercussions from their employer or the Scottish Government?
I've always said, I used to say it when I was Health Secretary, and I've always said it as First Minister, that I want people who work in the NHS, if they've got concerns, to be able to speak out about them. That said, NHS boards have processes that staff should go through to raise concerns, and it's sometimes, and I'm generalising here, and I don't expect a single journalist to agree with me on what I'm about to say, but sometimes it's not the best way to resolve a genuine concern to raise it through the media. Sometimes it is better to go through normal processes. But we have formal whistleblowing arrangements in the NHS as well. So I think it is important that people who work in the front line in our NHS are able to speak out. It's up to the CMO advisory group what they publish and when. I know they are looking at publishing more detailed minutes and more detailed accounts of their discussions and deliberations, and I'll let them announce what it is they intend to do rather than announce it for them. Richard Percival from the Daily Express is the last question.
Thank you, First Minister. I just wanted to ask about the furlough scheme, if possible. I understand that you are still seeking clarification from the Treasury, but Douglas Ross has said on, I believe, ITV yesterday that most people thought you were a better communicator than the Prime Minister at sort of dealing with the pandemic. I know obviously the Treasury haven't given you clarity on the actual furlough scheme, but do you think it's part of a wider message that the UK government are maybe sort of not sort of engaging with you not engaging with you as effectively as they should be, essentially?
Look, we've all got to engage with each other. We've all got to try and put politics aside in this and work together. And I think, by and large, there's been a real appetite to do that. And in many different aspects, we have done that successfully. On issues of finance, without going into detail, people will know what I'm getting at here. It's not a situation I like, that the levers lie with another government, but that's the reality. This is not about the Scottish Government not having money or Scotland not being able to afford it. It's about where the powers to access the money lie. The UK Government right now are borrowing money to pay for all of these schemes. We don't have those borrowing powers. So in the absence of the levers, we depend on the UK Government exercising them, and it gets frustrating when we don't get clarity about that, or when it appears that decisions are not being taken on a fair and even-handed basis across the UK, but instead are being driven by the needs in only one part of the UK. So I think people can understand why that is frustrating. For me, it is just as frustrating for Mark Drakeford. I'm sure it's just as frustrating for Arlene Foster and Michelle O'Neill in Northern Ireland, and it's not even just a Four Nations thing. I think everybody saw a couple of weeks ago the frustration of Andy Burnham, the Mayor of Manchester. So that's the reality, and therefore I think in these situations it is all the more incumbent on the Treasury to be clear. Whatever their decisions are, I might not like these decisions all of the time, but be clear about them so that we know the basis we're planning on. I hope we get the decision we're looking for and that the Prime Minister appeared to commit to on furlough, the 80% commitment beyond the 2nd of December. But actually, do you know what? The most important thing right now is clarity, so that we're not having to second guess and try to, work out what the situation is going to be the situation we're all dealing with right now is hard enough. This is the hardest thing any leader anywhere in the world will have dealt with, I think, almost without exception. Certainly it's true for me, and I'm sure it's true for Boris Johnson as well. We don't need to complicate it any further by unnecessary confusion and lack of clarity. So there you go. That's my perhaps frustrated but heartfelt appeal for the Treasury, just to tell us what the detail of the commitment is. Thank you very much for joining us today. Thanks to all the journalists. Anna, thank you to her for the BSL interpretation, to Shirley-Anne and to Gregor. And thanks to all of you. Today, as I try to do, but sometimes I put more of an emphasis on this than normal, is just to take you inside the decision-making process a little bit. I've always thought that's important. It usually leads to lots of media speculation, fair enough, but I think that's a price worth paying to share the factors we have to take account of as we reach these difficult decisions. In summary, we have grounds, to use Gregor's phrase, for cautious optimism right now, but we have no grounds for complacency. And it's not enough, for the reasons I've set out, for us to stop a deterioration in the spread of the virus. We have to see a significant improvement. Otherwise, we risk going further into winter with a very unstable position. So that, if you only remember one thing about this briefing, that's the kind of factor I ask you to remember, because that will be a key consideration as we reach decisions next week. The new level system, I hope as it settles in across the country, it will help us suppress the virus. From a planning perspective, it's helpful because it's flexible. We can put different parts of the country into different levels if that's appropriate. If we needed to, we could apply a level across the whole country. It allows us to respond much more flexibly and on a much more targeted basis. But the most important thing to remember is that this is not just about government. Every single one of us has a part to play in making sure that we see that progress and improvement that we desperately need to see. And that means sticking to the rules and doing everything that's been asked of all of us right now. Not putting our own twist or interpretation on the rules, not pushing them to the very limits and finding the loopholes or bursting your way through them, but actually remembering why these rules are in place, remembering what the purpose of them is and sticking to the spirit of them. They are about, unfortunately, reducing as much as possible our contacts with people in other households and making sure that when we come into contact, we're minimising the risks of transmission. So please remember that, and remember facts. Face coverings, avoid crowded places, clean hands and surfaces, 2 metres distance, and self-isolate and get tested if you have symptoms. Thank you very much indeed. I will be back here at 12:15. I hope tomorrow I'm appearing before the Scottish Parliament COVID committee for a couple of hours in the morning, and assuming that all ends on time, I will hot-foot it back here to see you at 12:15. In the meantime, thanks for joining us today.